So if you're thinking about your HIV and how well controlled it is, there are two numbers that you're going to look at. One of them is your CD4, which tells you how strong your immune system is, and the higher that number is, the better. And the other one is your viral load. And your viral load is an interesting number because that's the number we look at to tell us how much HIV is replicating inside of your body. What we want for the viral load is that we want it to be as low as possible. We want it to essentially be undetected. And undetectable basically means that the lab instruments that we're using, which are pretty sensitive, are counting such little amounts of HIV in that drop of blood that essentially it's undetectable for that amount of blood. However, if you were to stop taking your antiretrovirals and were to come back and test you in a week or 2 weeks, you would see that your viral load had gone up, because the thing that's keeping your viral load low is your antiretrovirals that you're taking. And so you would think that if those medicines can go into your body and go into those cells and destroy HIV, why do you still have HIV? And it's because HIV is a very smart virus, and basically what it does is it hides itself in reservoirs in your body. The second you stop using antiretrovirals, that HIV starts to do what viruses do, which is to grow. So as of now, we do not have a cure for HIV. And that's really important to know because sometimes people act more recklessly when they think, well, even if I get HIV, the scientists are going to cure it, no problem. That's unfortunately not the case, and it's important that people understand that HIV remains an incurable disease. So it's a myth that people who are HIV positive have to stop having sex because HIV is a disease that is now treated as a chronic disease. That's like saying that people who have diabetes can never ever have ice cream ever again. If you control your HIV, which you can do through taking medications, then you can absolutely engage in the world the way that anyone who didn't have HIV can engage, including having sex, unprotected sex, and including kind of doing all the things that someone without HIV can do. But the key there is you have to take those medications. So there's another myth that HIV is a death sentence, and that actually came from what HIV used to be in the past. And that was because at that time, scientists were just learning about what HIV was. They had no medications really to treat it. And so yes, HIV at that time was a death sentence. That was all the way back in the 1980s. And so now, in the time that we're in, science, which is pretty amazing, has developed so many medications and so many options of medications that'll basically keep your HIV under control. And if you keep your HIV viral level low and you keep your immune system strong, then you can basically live a life that's almost like if you didn't have HIV at all.